So good morning, good afternoon, good evening, everyone, wherever you are, and welcome to this webinar session on how immunization supply chain contributes to reaching zero-dose communities. Today, this session is interpreted into French and Spanish. If you want to listen to this presentation in one of these languages, please use the globe at the bottom of the screen, select the language you desire. Then we are recording this session as well, and we're going to share the recording after the session. And if you have any question during the session, please don't hesitate to ask them at any point in the Q&A box. The Q&A box can be found at the bottom of your window Zoom, and the questions will be answered after the presentation. Olamide, I think the floor is yours.
Thanks very much, Alex. Hi, everyone. Good morning, good afternoon, good evening, wherever you're joining us from. It's nice to have you join the first in this series on supply chain and how supply chain contributes to identifying, targeting, and reaching zero-dose communities. Today, the focus of the first webinar will be supply chain guidance and strategies to reach underserved and unserved zero-dose communities. And we have Karan Saga and Michelle Siedel from the Gavi Secretariat and the UNICEF headquarters, and myself presenting. So Karan is the head of the Comprehensive Vaccine Management team at Gavi, based out of Geneva. And has extensive years of experience working in low and middle-income countries, supporting health system strengthening and immunization. And Michelle Seidel is team lead and senior advisor immunization, team lead of supply chain at the UNICEF headquarters program group. So we're happy to have them presenting today with myself, and I'm hoping that you would benefit tremendously from this webinar and also join us in the subsequent two webinars. So without further ado, like Alex said, please use the Q&A for questions, or when it's time, you can raise your hand, and we're hoping that we'll be able to address your questions. We'll have like 20 minutes each for each speaker, and perhaps we would pause after the first two and take questions before the last one, but at any time you have questions, please go ahead and ask, and we'll try to answer in the Q&A. Yes, like Alex has dropped in the chat function, you can also please go ahead and introduce yourself, and that would be fantastic. So please sit back and enjoy, and I'll pass on to Karan now to pick us up.
Thank you, Olamide. And once again, warm welcome to all of you. And I am happy to kind of present today on behalf of the Immunization Supply Chain Steering Committee for the Gavi Alliance. And as you know, today we are discussing about the different guidance and strategies that can help us to reach underserved and zero-dose communities. So I will begin with the strategy, which is around Gavi Alliance's immunization strategy for 2021 to 2025 for identifying, targeting, and reaching zero-dose populations. So this strategy is running from a period of 2021 to 2025. We are we have completed a couple of years of this. And why this strategy has been a kind of, we had a strategy prior to this as part of the Gavi 4.0 period, which was running from 2016 to 2020, which was speaking about ultimately about vaccine coverage and equity, and how supply chains through different levers of supply chain, optimized equipments, continuous improvement process, data for management, and human resources could help achieve improve availability of potent vaccines and mitigate the risks of the loss of these vaccines. And the systems are efficient and resilient. So what we have done is we've actually built on the 4.0 strategy and looked at what worked well and what did not work well in the 4.0, and then devised this immunization supply chain strategy for the Alliance. And this is very much aligned to overall Gavi 5.0 strategy of leaving no one behind, and emphasizing on zero dose, as well as how does supply chain through comprehensive vaccine management ensure that we are reaching this goal of leaving no one behind. As you know, supply chains are the backbone of the immunization program and definitely a key lever alongside demand and service delivery to really achieve this particular goal. So what we have done is that there are now more investment priorities under this strategy, which are looking at a holistic way of incorporating supply chain elements which are required to attain the goals of this strategy. In the previous strategy, there were 5 of these, now we have 6. But what we realized in the previous one is that we were really focusing mostly on 2 or 3, and the majority of our investments really were going into, say, the infrastructure related or the capacity building related activities, and that is where we started seeing improvements. But with this pivot to under 5.0, we are looking at a more holistic way of assessing what are the issues and gaps in supply chains within the countries and helping them to design their approaches and ensure that those approaches are then funded through their own domestic resources, as well as Gavi funding or other donor funding. And this is trying to boost investments in areas that need the most attention in these countries. We also looked at other weakness, which was around the the responsibilities. So this time, what we're looking at is identifying the stakeholders at global level, at regional level, and at country level, and clearly assigning responsibilities and setting accountabilities. You'll see later in the presentation what are those mechanisms, and also ensuring that what are the clear measurement approaches to enable monitor the progress. If I were to sum up what we are kind of focusing on, and I'll get to each of these in details, but overall the vision is to have strong supply chains that enable delivery of life-saving vaccines to every person when needed, no matter where they are. And the idea here is to focus on equity and efficiency so that we are mitigating the challenge that we have seen of inconsistent availability of high quality vaccines and the limited reach of vaccine supply chains in the underserved populations, which threaten the access to immunization coverage and equity outcomes. We will see what are the different investment priorities. There are 6 of them which have been defined. We have also defined what are the enablers for doing this, and we have also defined what are the impact goals on this. So going to some of the, so as I said earlier, what is the issue and the challenge, and I've already spoken about this, and I'll not repeat it, but the major challenge we were addressing was availability of vaccines at the last mile where they are really required. So what do we mean really when we start saying the vision, we start looking at the vision, what is it that we are trying to say here? You would see there are certain words which really are the framework for this particular strategy. So strong meaning resilient, sustainable, efficient, and adaptive supply chains enable the other keyword here is enabling delivery, which is meaning that the supply chains and availability of vaccine, and also not only vaccines, but other related components which are required for delivery of the immunization services. Every person, as I have said, it is aligned to ensuring that there is equitable access to immunization services for each population segment when needed, that there is sufficient vaccines which are available whenever they are needed in a timely manner and where they're actually required. So meaning that sufficient vaccines are available where they are needed, again, in a timely manner. So that is, I think, more or less in terms of defining the keywords within the strategy. What are the coming to what are the main kind of impact goals? As you would see, some of the impact goals are around extending reach which means that the supply chains extend the reach to last mile. And that is where this whole zero dose concept is really getting focused within our strategy. And where the second aspect is around vaccine availability. Again, it is not only just the availability, but also the high quality vaccines are available in adequate quantities when and where they are needed. The focus is around supply chain efficiencies so that we have well-functioning supply chains which are minimizing the operational costs. And this is operational costs not only to the governments, but also to the donors, and ensuring that product waste is minimized. There are interconnected people, systems, and structures in place to have more efficiency within the system. The supply chains need to be sustainable. So the government-led, obviously, the whole the effort is that governments own these supply chains. They have to lead the supply chain activities and providing adequate benefit for without compromising the needs of future generations. And this is both in terms of financial, programmatic, and environmental sustainability that we are looking at. In terms of resilience, we all know what has happened in the past couple of years with the COVID response. So our supply chains need to be agile and prepared to adapt to sudden changes, which could include the natural disasters, which are happening now almost on a daily basis, and the outbreak of infectious diseases or the pandemics that we have seen in the last couple of years. And they should be responsive. That what we mean by responsive is that these are people-centered supply chain which respond to the needs and preferences of people throughout their life course. Because as you know, the immunization schedules or immunization, more and more vaccines are being made available. We have new vaccines, we have older vaccines, we have vaccines for HPV, malaria vaccine being launched in a number of other countries. There are other vaccines which are available. Of course, the COVID vaccine itself was being made available throughout the life course. So the idea is to have supply chains which are responsive to the needs, both of the emerging needs of the program as well as of the people throughout the life course. So how do we achieve this? So this is primarily through targeted assessments or investments in 6 priority areas, which are supported by 5 enablers. Now, we all know that to do good quality planning and monitoring of the program, data is the centerpiece. And hence you would see that data visibility and use at and as far as possible to make real-time data available at all levels of supply chain and encourage the data used by decision makers to improve supply chain performance. So we are now looking at how we can enable the countries to make these investments in good LMIS systems that would help them to really get this data on a real time, and that can help them with the second aspect, which is strategic planning. And this has to be really led by it has to be informed by people's need, and the planning has to be really adequately financed both by the domestic resources of the government as well as supported by the donors. The third investment priority for us is around system optimization and segmentation. So to design an optimized supply chain that reach everyone at a minimum cost and waste. So last mile delivery is very, very key here, so that we are able to reach these zero dose kids and communities and do that in an efficient manner, minimizing the cost and also minimizing the waste, which the immunization waste as well as the vaccine wastage which is occurring in the system. It has to be really anchored with capacity development and professionalization, so that we have adequate staff at all levels for supply chains who are really equipped to do their jobs through tools, through knowledge, through other resources which are required for them to really be a motivated and competent staff working in supply chains. Fundamental infrastructure still remains an important priority, where we have to ensure that the vaccines are stored and transported in well-functioning equipments to ensure the quality of these vaccines. Last but not the least is around smart harmonization, where we have to really look at how we can, as immunization supply chains, as you would know, in a large number of countries are running in parallel. How can we integrate and harmonize immunization supply chain with other public health supply chain program functions and overall health systems to maximize these resources, be it through integrating of other public health products within the supply chains, or be it through leveraging other supply chains delivery and other models. Again, what are the enablers for this? We know that country leadership and governance and stewardship is a very, very important aspect, and this cannot really be undermined. So country governments are central stewards of whatever they're doing in terms of the policy and the implementation of the policies, providing the oversight for entire supply chain across the sector. Funding is again an important aspect where we are saying we have to make the most of both the domestic and international resources, and it has to be contextualized based on what the country really requires in terms of funding. Partner alignment and coordination. We have a number of partners who are supporting the countries at different levels, be it national level or be it at the subnational level. However, we need to ensure that there are mechanisms in place which are able to help countries in terms of partner coordination. That is by setting up the National Logistics Working Group or Subnational Logistics Working Group in large countries, and ensuring that there is harmonization in the work planning of the partners, avoiding duplications, and achieving a collective impact which is really driven by the country itself in terms of what they need to do to improve and strengthen supply chains to deliver these vaccines to the last mile. Innovations, we all know there are a number of innovations which are available for us to really work on and help support the current supply chains. We are now seeing a kind of almost on, say, for example, on machine learning and artificial intelligence coming in terms of LMIS systems, in terms of blockchain, so or even in terms of solar fridges or other equipments which can help to really deliver these vaccines at the last mile. So how do we really identify these innovations and are able to use these innovations within the immunization supply chains is another big enabler. And last but not the least is the private sector engagement. We know we can learn a lot from the private sector of how they are doing it and how this can really help in terms of, we know that, say, for example, a Coke bottle is available in every village, but our vaccines are not reaching. So how can we learn as to what are the systems and processes they put in place, what are the capacity building aspects that they put in place in the private sector that can be leveraged within the immunization supply chains and in primary healthcare supply chains as a whole. Obviously, this the strategy that we have, I will not get into the details of this, but it also provides scenarios, potential scenarios for use, that how the countries can use this for program planning, prioritization, design and development, assessments, monitoring, evaluation, continuous improvement around advocacy, learning and growth, and around resource mobilization. This is relevant for the governments, the alliance partners, donors and funders, civil society, academia, private sector, and immunization supply chain providers. So there are specific use cases for each of these set of players, and they can use this strategy for the different use cases that are mentioned here on the slide. We definitely need to also monitor what we are doing, and we have set for ourselves certain monitors around each of at the portfolio level, but also at each of the for each of the 6 priority areas. So at the portfolio level, we are looking at full stock availability. We are looking at the composite effective vaccine management assessment scores. Within that, we are also looking for the availability, quality, and efficiency EVM scores in the countries. As I said earlier, there are there are indicators which are against each of the 6 investment priority areas, and we have set these these are being communicated to the countries during different forums like the webinar today. So I will not get into these the individual indicators, but you can see that there are indicators for each of the 6 investment priority areas. We have also defined as to who will be helping to measure this, and what would be the frequency of reporting of these indicators. We have also devised practical approaches for the strategy to get implemented into action around each of the different areas. You can see this. There are callouts on this, which I will describe in the next slide, around all of these different areas on data visibility, use, capacity development, fundamental infrastructure, planning, optimization, and smart integration and harmonization. So there are different actions that you can really look at. But how do you really approach and pivot this whole strategy into action? So we are looking at a comprehensive vaccine management approach, which is looking to pivot the delivery of the investment areas for Gavi 5.0 and contributing to the strategy achievements of the Alliance strategy. As you would see that there are different areas which have been identified as high priority, medium priority, and low priority, which can help us achieve this the goals of the strategy with a focus on equity, which is 0 dose, as well as around efficiency. And just to highlight the ones which we feel are really important and high priority is around, for example, the data-driven forecasting, supply planning, end-to-end vaccine and dry commodity stock management, strengthened immunization supply chain data, quality data use, and the systems thereof, distribution, which is a weak point, distribution and network design, governance, which is around availability and functionality of national and subnational technical working group like the National Logistics Working Group, and of course the optimal supply chain and health worker number, capacity, and skills to do. And within the infrastructure, we are looking at not only looking at putting the infrastructure in place, but also ensuring that we have the right kind of information to assess gaps, and also focusing more now on preventive and corrective maintenance. Gavi, for example, has put in countries with country joint investments, of course, close to 74,000 fridges under the cold chain equipment optimization platform. So that's a lot of investment which has gone in these countries. Now the focus is how do you assess that they are functioning properly, and there are mechanisms put in place for preventive and corrective maintenance. And so those you would see are the high priority kind of actions under the CVM approach, which would help us really to pivot the operationalization and reach our common goal of equity as well as efficiency within the supply chains. With that, I will kind of end and hand over back to Olamide for the next presentation.
Thanks very much, Karan, for the presentation. I'm thinking maybe we just pause for about 5 minutes, take questions. So if anyone wants to raise their hand, I think we had a couple in the Q&A. So Karan, if you just want to respond to questions at this point. Thanks, Karan, for the presentation from Oyanga Okech. Could you give more highlights on smart harmonization of ISC with other public health programming, perhaps with relevant examples for us to learn from? Thanks. Of course, it could be from any of the panelists too. Karan, do you want to have a go?
So definitely, let me give it a go, and then of course I'll let Michelle also come in. So in terms of the LMIS and the tools that we are looking at, obviously LMIS investments really require a lot of planning, and it's not a short-term kind of a thing. It requires to be done on a longer-term basis. So we have developed a strategy for the Alliance in terms of rollout of LMIS systems within the countries, where we are right now focusing on the ensuring that the countries are equipped to have LMIS systems in place which are meeting certain standards. So there is, as some of you may know, there is Gavi and Global Fund and others had developed target software standards. And these target software standards are some things that that is something which we are currently revising, though. But we have the LMIS systems which are meeting those requirements, and the countries, we are working with the countries to ensure that these systems are put in place up to maybe the district level, and then also leveraging, the DHIS platform which exists in many of these countries to get the information from the health facility or the levels below the district level. So a smooth integration of those is going to be really required, and that is something as also an example of the harmonization itself, in terms of what we're looking at from smart harmonization of the supply chains. The integration and harmonization is primarily if there are public health. So we have the supply chains for immunization. You have supply chain for maybe HIV, TB, malaria. You have supply chains for MNCH products. So are there opportunities in terms of integration from that aspect, whether for immunization supply chains to leverage those and ensure that there is the last mile delivery of these commodities along with vaccines is happening. So that's probably an example of what we could look at in terms of the system for harmonization. Then there is this question around the course training syllabus that can be followed in ensuring capacity of practitioners are professionalized. A good question. I think there are a number of courses, and I'll let Michelle speak about the Agora courses which are run, which you can definitely, anybody is free to do those, and these are free courses available online that you can do at your own pace, and they cover a gamut of aspects under supply chain.
Thanks very much, Karan. Michelle, maybe you come in and then we'll move on. I'll come back to questions later. Michelle?
Right, just to add on the smart harmonization very, very quickly, I think what Karan has said is it's quite important that we look at a holistic approach, particularly as we we've seen a lot of verticalization of programs, and where, with IA 2030 goals, there is a move towards strengthening primary healthcare systems. So, and in that, we don't want, and I think in view of
the range, how much deficiency of supply chain.
Karan, you're on mute. So in terms of driving those efficiencies, and in terms of making sure that we have a full package of care at primary healthcare level, it is important that we have that smart harmonization. And we've seen that in countries in, for instance, Uganda with their CCOP, where they have integrated oxytocin into their supply chains, and they've done that by putting in specifically designed baskets into that. Other countries have done the type of integration through their logistics management information systems, and I think Bangladesh is an example there. So countries have done it in various ways, and I think it is up to countries to do it in a stepwise approach, and what makes sense and what is safe as well. Then with regards to the professionalization, UNICEF, WHO, we all offer a range of courses, but we are also driving towards localization and regional institutions that are training and sustaining supply chain courses. So while we are providing a lot of the content, it is also for the local institutions that are doing pre-service training or doing developing curriculums, etc., and training medical staff and so on, that they are also doing some of this post-service training as well, to make sure that health professionals in general, supply chain professionals, are getting the kind of training that is required, that meets the needs of the health system as well. Thanks.
Thanks very much, Michelle. So I think we'll just go to the next second presentation, and we will take more questions whilst we continue to use the Q&A function to answer more questions. So over to Michelle. As those that are joining us now, Michelle Seiler is the senior advisor organization with UNICEF headquarters and the team lead for Immunization Supply Chain, with years of experience supporting low-income countries on supply chain as strengthening health program in general. Over to you, Michelle.
Thanks, Olamide. So I was asked to give a bit of an overview of how UNICEF is supporting countries to reach underserved and zero-dose communities, particularly with regards to our strategy. Now, with COVID, with Gavi updating their strategy, with the IA 2030 being developed, UNICEF has just recently updated their immunization roadmap. And although it's not finalized, it is in the final stages of completion. So I am going to present the high levels of that now, and I will do a deep dive into some of the activities that we are focusing on in our priorities around immunization supply chain. But I also wanted to, because supply chain doesn't happen in a bubble, and that it is supportive around the immunization program, I just wanted to spend a little bit of time in terms of speaking about what we're doing in immunization in general. Sorry, I was just having some trouble there. So let me just jump into the slide. So, I mean, I think we all understand the value of immunization. So if I go through this slide, I really am preaching to the converted. So I'm not going to spend too much time speaking about this, other than to say that I think that the returns on investments from a human point of view, from a social point of view, and even from a financial point of view are far-reaching, and we have very good data to support this as well. So it really is a very good investment in every shape and form. But then we've also updated our roadmap because of the very the specific changing and evolving context that we've seen. So obviously on the top of everyone's mind is the COVID-19 pandemic and how that impacted health systems, economies, the demand for vaccination as well. There were changes in partnerships, etc. We've seen, and I think a lot of that was because of the COVID-19 pandemic as well, but the public health emergency. So we saw polio, measles outbreaks in a lot of areas, and multiple other diseases as well. Conflicts also on the rise, many humanitarian emergencies, and in some extreme weather events and other geographical events as well that are really impacting the health of populations. And then population dynamics itself too. I mean, population growth, urbanization, displacement, and even unprotected children in middle-income countries is really becoming a rising concern. And then, of course, we've also seen, as I mentioned before, the updated global strategies and partnerships. And then, of course, a very challenging social, economic, and political context as well. So therefore, we saw the need to update our strategy. Now, our roadmap is very much in support of UNICEF's strategic plan, as well as UNICEF's health strategy, which really is focused on ending preventable newborn and child deaths and promoting the health and the healthy development of all children. So I'm not going to focus too much on that because I do want to get into the meat of why we're here today. So the refresh emphasizes 6 areas, which is the zero-dose agenda, gender transformative programming, new approaches to social behavioral change. Immunization is a strong foundation for PHC. And I've spoken about supporting immunization in middle-income countries. And then, of course, resilience building and pandemic preparedness, which is very fresh in our minds. And I think, in terms of the objectives we want to create a world where, or achieve a world where every child, adolescent, and woman is fully and equally benefiting from vaccinations for good health, well-being, and the full realization of the potential. We want to do this through catch up and recovery, and working together with partners in order to achieve this, and addressing a lot of backsliding of immunization, and accelerating the Immunization Agenda 2030 goals. We really need to leave no one behind. So that equity agenda is very strong in our strategy. And then, of course, strengthening and sustaining immunization programs to sustainably reach target populations as well. And this is with full vaccination and essential primary healthcare services as well. So the objectives are creating an enabling environment for primary healthcare and immunization, which is, of course, a cornerstone of PHC, enhancing equitable access to quality immunization services, and then, of course, that demand that comes with it too. And of critical importance here is, of course, and related to the supply chain, is obviously making sure that countries have uninterrupted access to affordable vaccines and immunization-related supplies. And then, of course, improved availability of potent vaccines at service delivery points. And I'll explain a little bit how we do this. So some of the enablers of course, partnerships, which are critical to how we meet our objectives. Data and evidence, I mean, I think we're seeing that as stronger and stronger as well. Gender transformative programming is a key element. Innovation, multi-sectoral approaches, and I'll dive into that a little bit as well, particularly in some of our work. Immunization as a platform for PHC, and then the multifaceted approach to emergencies and pandemic preparedness. So we had done a bit of a mapping in terms of how our strategy addresses some of the IA 2030 goals, as well as the Gavi 5.0 strategy. And I think they are, and our strategy does support the achievement of these strategic objectives, because it's very important in terms of driving towards making sure that we're addressing these priorities. But I do want to focus now a little bit on the immunization supply chain component and action. So one of the key things we've seen from the evidence, from about 20 years of data from effective vaccine management assessments, is the fact that, and I think Olamide will speak to this a little bit later as well, is the fact that we do not have very good last mile availability of vaccines, and distribution of these vaccines is very poor. So last mile integrated PHC distribution is critical, and something that we want to support and make sure that we are supporting innovative approaches and partnerships for this, not just for vaccines, but for other essential health commodities as well. Secondly, we want to ensure that we are supporting sustainable and environmentally friendly immunization supply chain logistics. So under the banner of our experience in installing a lot of solar equipment as well, and with our work together with our water and sanitation teams in installing solar pumps and so on, we realized that working together, instead of installing solar panels for a for a solar pump or a refrigerator alone, we could improve the access to primary healthcare services and provide a full package of care at the primary healthcare level through the solarization of health facilities. And we've been working with Gabby on this as well. So leveraging those core expertise in cold chain and in water and sanitation and hygiene, and then supporting these strategic partnerships for both the reverse logistics components as well as waste management systems for vaccines and PHC commodities. And then evidence-based planning and decision-making, critical to us as well. So making sure that both at the national and subnational level, technical working groups have the capacity to manage those stocks and the cold chain equipment and respond to under and overstocks in real time using existing systems and tools and linking these to operational systems. To strengthen to strengthen both the data quality as well as the responses that these national logistics working groups will be having to the data that they're seeing as well. And this will include the supportive supervision actions or addressing any bottlenecks that are seen through the data. And then, of course, improved immunization supply chain. So, with our partnership with WHO, making sure that we are strengthening government capacity to do effective vaccine management assessments and creating that fiscal space to ensure that comprehensive improvement plans are not only budgeted for and but implemented as well, and that we're linking that to broader strategic initiatives like national immunization strategies, FPPs, and so on as well. So I spoke a little bit about the DRIVE initiative, and this is really about last mile delivery and this will contribute to the reduction in the number of unvaccinated and undervaccinated in different contexts. And we really want to use young people and other stakeholders responsible for last mile distribution. So it really differs because we don't want to be utilizing healthcare workers that traditionally that are traditionally fetching vaccines from the district level. We would rather that they are caring for patients, vaccinating children, etc., and making sure that there's this dedicated distribution financing that's available, and making sure that we are leveraging this opportunity for additional stock monitoring and so on as well, and that there's this multi-stakeholder engagement as well with government at the driving seat. Now, I've spoken a little bit about the primary healthcare, but I mean, the elements are the solarization piece, WASH, waste management, and of course we need to make sure that we have an integrated capacity development plan, as well as making sure that we are managing commissioning, operations, and maintenance as well. And this is not only for our carbon footprint in countries, not only for climate resilience, but also in terms of reaching a lot of communities where there is no electricity, there is no power, and so on. And then, of course, the data component, which I'd spoken about. And we have done a lot of work with the University of Oslo to connect information from DHIS2 to understand where there are low coverage rates, and link that with stock data to project shortfalls in stocks, to understand where there might be stockouts, and to guide where a supportive supervision might be required, etc. So a lot of analytical work being done on that front as well, and where we're prioritizing. And of course, I mean, you know, together with the Gavi Alliance, the procurement, the installation, the maintenance of cold chain equipment, which we have been doing over the last couple of years and will continue to do, is critical and is the backbone of the immunization program. And then, as I had mentioned, making sure that implementing any action plan is going to be important. So making sure that those improvement plans are updated, are actionable, are monitored. So from moving from an EVM assessment to making sure that there's implementation of plans in an actionable way, to make sure that there's that supply chain performance, so that we have that consistent vaccine availability at the last mile, is going to be critical. So we really making sure that we have that systematic progress monitoring too. So in terms of this, we have updated our roadmap to make sure that it emphasizes the Gavi 5.0 strategy, the IA 2030, also looked at the COVID-19 pandemic, as well as the increased importance of the missed children in middle income countries as well. And we have made sure that we are also fundamentally supporting the zero dose agenda, primary healthcare as well, as a vehicle to reaching these underserved communities. So with that, I hand it back over to Olamide. Thank you.
Olamide?
Thanks very much, Michelle. I hope everyone can hear me okay.
Yes.
Just navigate to sharing. Everyone can see my screen okay, Alex?
Yes, we can see your screen. Can you make it full screen, please?
I think it's on full screen now. Yeah.
It is not.
Oh. I'll go again.
No. So perhaps can you stop sharing and share again? Looks like there's a connection issue on your side, Olamide. Your video is frozen, and Can you hear me, Olamide? Michelle, could you confirm that the problem comes from Olamide, or is it me?
I can hear you. Yeah.
I think we lost Olamide, no? Yeah, we lost Olamide. I think he has an issue with his connection. We lost Olamide.
Maybe we can move to some Q&A.
Yeah, that's a good idea. Could you take care of it?
Yeah, sure.
Thank you.
Great. So, okay. Oops. Okay, so it looks like Olamide is back.
Olamide is back. Yes, let's try. Okay, now it's working. Olamide, are you with us?
Can you hear me okay now?
Yeah, we can hear you and we can see the full screen. Okay, good. I think you had an issue with your connection.
It chose the perfect time to.
Yeah, it's always like that. C'est la vie.
Thanks, Michelle and Karan. In the next couple of slides, before we can take questions again, we just things Karan and Michelle have talked about. Let's not forget that the other two webinars would still go into more details about some of these pieces. So bear with us. This first time I go about strategies and guidance that we have.
Olamide, sorry for interrupting. I think the connection on your side is a little bit weak. Perhaps can you turn off your camera to give it some air, and perhaps it could be better. Okay, thank you. Sorry about that.
We'll hope it's better. No, that's fine, please. So I think Michelle had touched on this. Apart from on top of the plateau of immunization coverage globally, regionally, and I'll guess in countries over the previous 10 decades from 2010. In the last 2 years, we've seen a deep, thanks to COVID, of immunization coverage globally, regionally, and nationally, and at the subnational level. And one of the important levers for ensuring that we can contribute to catching up and recovering, but also accelerating coverage is immunization. And that's one of the reasons why we are setting up these webinars to discuss guidance strategies, but also evidence from countries on how they've been able to use supply chain as one of the levers to identifying, targeting, and reaching zero-dose children. Now, where are these zero-dose children located? The Western Central Africa, Asia, Eastern Southern Africa, and the East Asia are large contributors to almost 74% of zero-dose children, and that's extremely important because if we want to reach zero-dose children, we have to go where they are, and where they are, colleagues working at regions and especially at country level needs to support deliberate. This will not be, oh, let's do things as usual. There have to be deliberate activities tailored to identifying the zero-dose populations and communities, targeting them with context-appropriate activities, and also reaching them with these services. If we come to supply chains, in between 2009 and 2020, the EVM assessment conducted there then showed really we see that weak performance in maintenance, stock management, and vaccine distribution. I will know that stock management and vaccine distribution particularly are great opportunities for identifying, targeting, and reaching zero-dose populations. But again, this is extremely, we're showing this because it's one of the ways that you can disaggregate your data. We have all the EVM data in country for specific countries. I think one of the questions that was raised before was what are the specific activities that could be done? But this is a great starter to let you see how is the supply chain performing. So it's not just that one figure of your composite score that says 74%, but go into details and seeing what are the weak and weaker links and what's the weakest link. And we, like Michelle mentioned earlier, distribution, especially E7, especially at the subnational level, is one of the major drivers of low performance across supply chains, followed closely, not surprisingly, by stock management. So it's important that we have data and use data appropriately to be able to know and design programs to target those populations. Now, as most of us know, the effective vaccine management that Michelle also pointed out earlier, and Kiran, we had a new EVM 2.0 launched in 2019, and from then we've done about 40 assessments. And as you would see, if you look either on the chart above or on the heat map below, you will see the fact that as you move from the primary store to the lower levels, you will see reduced performance in supply chains. And as you compare metrics also, you see differentiated performance across the metrics, which is important to show where our interventions need to be tailored and targeted. So you see, apart from, yes, management, facilities management metrics like ISC performance monitoring, which is important to make sure that we know how the supply chain and programs are performing and design context-specific programs. Annual work planning, annual needs forecasting is extremely important. But the biggest levers, and especially ones that have the lowest performance, are actually also in the criteria and distribution of vaccines and dry goods. And as you will see, almost from the primary store, same picture as you have below, as you move from the primary store to the lower levels, you even see reducing performance, which shows us where the problems are. So if we're designing programs and we're not looking at this data, and more importantly, using this data to inform our context-specific interventions, then we would not be contributing to those reach as we are mandated to. So stock management and then maintenance following closely. So these are important levers that we must. If we look at, so from 2019 upward with the EVM2, we've been really looking at the availability, quality, and efficiency metrics of how our supply chains are performing. And same picture, but if you focus on the brown, the availability metrics you'll see that even from the primary store to the supply service delivery point, number one, availability is typically the lowest of the three. And beyond that, from the primary store to the lower levels, you have a decrease in performance and availability. And that would not be surprising, because you then see that cases of stock outs and reduction in motivation of mothers to bring their children to vaccination, and also touches on demand, low demand, and reinforces the vicious cycle how those children would continue to be. So again, using this data, this is aggregated across 40 assessments, 40 countries, but typically in your country, individual countries, to dig deep into the data you have on the supply chain performance and see where the bottlenecks are, and so that through your continuous improvement plans, you can design programs that will target those children. So we talked about this as a summary. Subnational and service points continue to be lower performing. Distribution and stock management are extremely important, and how we design specific context-specific interventions to really make sure that we identify, target, and reach those children is extremely important. So as we go into specifics now, or examples, just like a teaser to subsequent webinars, second and third webinars, we'll see that instead of prioritizing 4 areas that we know that where if supply chain activities or supply chain interventions, think from this lens, you would have increased potential to contribute to identifying, targeting, and reaching those populations. So remote, rural, because of geographic distance, urban, so they may be close to sources of vaccines, higher level sources, but primarily because of social barriers, or not targeted programming. Children there are not receiving vaccines. So how can the supply chain make sure that either coaching equipment, human resources, service delivery, and stock management practices and delivery services actually target and reach those places. It's not just because of distance, but because they're not receiving the service. It's extremely important. Communities affected by conflict or in emergencies, where you have displaced populations, where you have migrant populations, those are a bucket that are extremely important to make sure that we can target and reach those populations. Of course, we have gender barriers, which sometimes people struggle with how that intersects supply chains. And you're like, it just takes you to look at a country and you look at supply chain workers. Sometimes you don't even see a lady there. And that sometimes continue to reinforce some of the picture you see in the broader programming and how barriers are to caregivers, for example, to present their children for immunization services. Sometimes they prefer to see females like them. They don't have them in some communities. That doesn't lend them the ability to take children for immunization as caregivers. So the point is, how do you make supply chains closer and more accessible to women who are majority caregivers in some populations? So those are important considerations that we have to have. So it's sometimes just as simple as a coaching equipment. Most times that is more difficult than that and bigger than that system around the supply chain, from vaccine arrival to waste management, and make sure that things go on, specifically looking at those populations. But using all the assessment results we have, either from our EVM assessment, do some maturity assessment of deep dives, some equity assessment, being able to see what are the supply chain dependencies that are contributing to this limited equity, limited coverage, and inequities that we're seeing, and persistent zero-dose children. And we see, we're not going into detail, but these are examples. We don't have the slides to look at either cost barriers in some places, either lack of disaggregated data, or just penchant to continue to aggregate data, supply chain interruptions in affected communities affected by conflict or in emergencies, or you have even social distance between populations and services, just because of either being some cultural barriers or they're living in slums. Economic barriers are extremely important to be able to see how do we then look at the supply chain in a holistic way to make sure that we can tailor. So anytime we are trying to design activities for supply chains, and typical activities that we've done for 30 years come to your mind, then probably know that we may not be doing what we need to do to contribute to reaching the zero dose. But when you start challenging ourselves based on data, based on looking at disaggregated data, based on specific attention to key populations and differentiated populations, examples for this four, then we'll be positioning ourselves to contribute. And we have the guidance that you would benefit from viewing that shows cross-cutting themes. So like we talked about, having aggregated, disaggregated data to identify and track when you provided services, engaging diverse stakeholders in direct vaccine delivery, for example, that we'll talk about in a bit. We'll talk about integrated approaches, either with demand generation, either with community ownership, either with distribution or with storage, that just makes sure that you're leveraging potentials across supply chains and across the even levels of supply chain is extremely important. And then prioritize budgets for key populations. If we say the cost of serving the typical population will be the same cost we would allocate to a community that is 1,000 kilometers or 500 kilometers away, then we will not be addressing zero-dose populations. So our budget, supply chain budgets, have to be disaggregated across population areas to make sure that we have key attention to some populations to make sure that we can target and reach them. And then we have specific examples of key strategies that we can use across these different population groups. For example, agile strategies to make sure that if there are in urban poor, for example, if they are disenfranchised or informal populations just because they move from another state to another state and they're not registered in that state, or they don't seem to be part of that community, and they're not presenting themselves for service. So how do we make sure that our service delivery, supported and driven by an agile supply chain, reaches those communities? And that's extremely important. And in remote rural areas, it will be just varying the stock allocation to those areas. In a place where most in supply chains colleagues will still have that mentality that, okay, it must be 2 months, all the sites at this level. It must be 1 month, all the sites at this level. It must be 1 week, all the sites at this level. But as we look at populations where those populations are mostly located, and we vary stock allocation according to the capacity to manage, of course, but being able to be strategic and agile about that will extremely contribute to reaching and targeting and reaching these populations. Or in conflict settings, engaging stakeholders that can have a wider reach than regular stakeholders. So if you say a supply chain worker or a health worker should come pick up vaccines where it's prone to conflict, but there could be civil society organizations, NGOs that further reach that. And then thinking about the potential implications of that, of cold chain or infrastructure damage is important in those places. So these are key strategies, and you would have to see the link to the guidance and to make sure that you can review it and look at your programs. If we are not paying attention to some of these pieces in a more differentiated, context-specific approach, then we will not be contributing holistically to it. So we have opportunities. So where we see challenges for supply chains, there are also opportunities. Directly delivering vaccines to health facilities and outreach locations, like Michelle mentioned earlier, reducing the time or even taking it out completely that health workers would spend on logistics or supply chain is extremely important, because as we continue to see, as we've seen in the EVM analysis, distribution is the weakest link in our supply chains. Early identification of stock variations or potential stock outs and responding tangible in a timely manner is extremely important. That's what our stock management principles, tools support us with. Then ensuring that we have availability of vaccine at last mile by interventions, varying the stock allocated to them, optimizing and outreaches through supply chain interventions is extremely important. So we said reducing the time that's spent. We've talked about that. Reduction in the supply time from request to replenishment is important. Whatever mechanism we can use to make sure that is done is important. Then HR, oftentimes that's an afterthought. How we make sure that our human resources are positioned appropriately and deployed importantly to places where we have either of those communities is important. So Michelle mentioned about Drive, and I'll not go through the introduction, but I'll just deep dive into a few pieces that will give you an idea of what Drive is, and we'll be reaching out to some of the countries to support in operationalizing this. It's this, like we said, one of the last mile distribution and delivery initiative to make sure that we can increase availability of vaccines and other primary healthcare commodities at the last mile. So our goal is to reduce unimmunized children and underimmunized children, contribute to increased coverage and equity, but also contribute to local economy through ensuring that we have direct last mile delivery. So rather than health workers coming to pick up vaccines, as we'll give the classical example, anytime you look from the primary store to the service point, you will see that almost all primary stores in most countries would have a refrigerated truck. And they typically directly distribute to the regions or to province, the next layer. But the further you go down the supply chain, the more you see that mechanism doesn't exist. And especially at the last mile, then depend on health workers to go pick up vaccines without any challenge. So directly delivering vaccines and other commodities last mile is one intervention that we know that worked, but we want to, through the Drive initiative, deliver that in a sustainable fashion that countries can even take them up themselves. And there's no other lever than leveraging local last mile stakeholders that will be nimble, that know the community, but also generate ownership. But because we know that not just direct delivery is important, but there are also other supply chain and broader health activities. So those are the companion activities that would design, depending on context, in addition to the direct last mile delivery of activities. And we hope that we introduce this through innovative ways, engaging stakeholders like people, small and medium scale enterprises, community organizations, NGOs, who may not have as much knowledge in supply chain, but the capacity can be built in a quick way. And we can put risk mitigation principles in place to make sure that there are no challenges. Vaccine security is maintained. And all this, as you would imagine, a lot of stakeholders will be involved, will be facilitated by a technology platform. But this is not a technology platform is not a deal breaker. Appropriate mechanism in countries can also make sure that stakeholders are engaged in an appropriate way. And I think Michelle has talked about this earlier, so I don't need to go over it again. But the most important thing on this slide is to know that Drive Initiative tries to implement sustainable business models, and that's what we're hoping to implement in a way that will be sustainable in the long run. So one of the things we'll be considering with countries is the fact that we can leverage shared distribution of vaccines and other commodities to make sure that the cost of distribution is reduced as much as possible. Innovative financing is another consideration. If we can provide seed funding to last mile providers, to last mile stakeholders, that they can use the asset for other things if they commit to specific number of deliveries. For example, that would assure that these health workers are delivering health service, but also vaccines are delivered. We can also do health product delivery impact bonds, like we have some bonds that have been implemented for other health programs. And hopefully this makes stakeholders realize the value of or the cost, the true cost of distribution, and also make sure that that can receive the attention that it deserves. I often say that if you ask any country API manager, typically, what is the cost of the vaccines going through their supply chain, their throughput every year, they'll probably be able to tell you, if not right away off, they'll be able to tell you by looking at the spreadsheet on their laptop. But if you ask that same question, what's the cost of distributing that vaccine to the last mile, then they probably will not be able to tell you. So hopefully through the Drive Initiative, such things are being leveraged to make sure that some of the reasons why we still have some challenges are because we're not paying attention to some of this content. Then this slide was also shown earlier, but in a way that we make sure that stock management is also extremely important, and Tritricity is contributing to that by making sure that, you remember one of the opportunities we discussed earlier was identifying stock variation trends and being able to preempt that, provide immediate solutions to make sure that you can nip that board before they become stock out. Or if you notice it as a trend, you prevent it in future. So, like I said, these are examples both with last mile distribution, stock management examples, and hopefully we'll dive deep into even bigger, more examples. The second and third webinar taking place 16th and 23rd, not 2nd February and 9th February. So I'll stop there and then open to questions. Inviting Michelle and Haran also back, and we'll see if there's any outstanding question you want to take live, and then we can look at the Q&A also. So, Jean, I see a question that you inserted in. I hope everyone can hear me okay. I hope everyone can hear me okay.
We hear you, Olamide.
Okay.
This is Nicholas here. I wanted to answer one question, if I may.
Yes, please go ahead.
And that's a question from Charles Charcter, and I will not answer it in French because you're not going to have that much fun. But I will try to answer it in English. And if I understand his question correctly, he is pointing out that there are now catch-up campaigns, large catch-up campaigns going on in Niger, vaccinating children with the first dose of pentavalent vaccine, and that this causes an accumulation of children who have not received the third dose of pentavalent vaccine. So the number of under-immunized or incompletely immunized children is increasing. And that is, of course, not the purpose. The purpose of the zero-dose approach or the zero-dose strategy is not to vaccinate children with just one dose of pentavalent or DTP vaccine. The purpose, the goal is to bring children from the first dose to the last dose, from penta1 or DTP1 to measles 2. And that's why even if campaigns may be important in the short term, they are not the solution, of course. The solution is to sustainably get children into the immunization program and make sure that they come out in the other end, so to say, with the second dose of measles, and later on also if there are other doses of tetanus boosters and HPV. And that is really my point, that the purpose of the zero dose focus has never been just to vaccinate with the first dose of DTP. That is just an indicator of how many children are missed. Over.
Thank you very much, Nicholas, for chiming in. That appreciated. So I think, Jean, your question about integration and the fact that we continue to encourage countries to integrate, but oftentimes immunization is a step ahead, just like Nicholas, you typed it in French. And as you see, I'm responding in French. Apologies. The immunization supply chain typically a step higher than others. So other supply chain, and it may appear not to be efficient. We then integrate. Is it really effective? Can we give examples? I think Michelle talked about Uganda integrating oxytocin into the immunization supply chain, even in specific settings. So there are examples. Senegal had implemented it at some point also. I think the principle, if we all agree on the principle is sustainability. The principle is efficiency. Even if you say that the immunization supply chain is performing than other supply chains, the goal is that at least can we leverage the performance of immunization for other supply chain in a way that it doesn't hurt immunization. And if you look at WHO and UNICEF guidance on integration, there are flags for you and considerations before you do integration. Number one, appropriate labeling. If you do storage, you have to label products appropriately. You have to make sure that at least during distribution, because a lot of temperature excursions also happen during distribution, you don't use the same, or even if you use the same device to distribute or transport, it's important to clearly mark and delimit based on the profile of each of the products. If you do that all successfully, and you can have good monitoring stock management principles between during distribution or through the supply chain, I think that would address the problem. But we can continue to big work about that. I think the greatest challenge we've seen is mind shift, policy changes. Everyone thinking it has to continue in parallel, and that that supply chain is not mine. I don't have oversight of that, but working together to contribute to that. Michelle or Karan, any question you want to jump in on? So I think Bode is asking about the Gavi CVM and the EVMA. And and the interrelationship between them? That's a great question. They are interlinked and also different. So EVMA, as you know, are regular assessments that countries do a couple of years apart, are major input into the comprehensive vaccine management. The comprehensive vaccine management is a lever to operationalize the strategy, the Gavi Alliance strategy that Karan talked about, which is looking at a differentiated approach to the 6 investment areas, to prioritizing the 6 investment areas that Karan talked about. So so EVM is one of the inputs in informing the CVM approach, but it is not the CVM approach. The CVM approach would continue to help countries, especially those that have their full portfolio planning from Gavi, with Gavi, to be able to identify areas where they need to, across the 6 investment areas, where they need to then develop activities so that they can improve on what they've seen in the gap analysis that we conducted with the CVM. And like you said, those recommendations, apart from making it to the portfolio planning, ideally would need to be inserted, used to update the country improvement plan. So you're exactly right. That's really the aim of it, to speak to one another. So I think there's a question about countries are not willing to invest in GS1 standard LMIS systems. How do we advocate? I don't know if Karen wants to take it.
Yeah, no, thank you so much for that question. I think it is very important to make them understand the value add of having this data available for their planning purposes and monitoring purposes. So take examples, and there are cases, say, from countries like India and Tanzania and other places, where having an LMIS system in place has helped the country to decrease the overall cost of vaccines being procured, because they need to procure, say, lesser vaccine because they know which vaccines are there. So there is definitely merit in terms of introducing the LMIS systems, and we will have to make that case with the countries that yes, it may be an upfront investment to introduce these LMIS systems, but in longer run they will pay for themselves, because you would be able to save, you would be able to avoid extra inventory in the system. You would be able to monitor how much of it is being used. You will also be able to monitor how much of it is being wasted. What are the reasons for that? You can go and deep dive into that and ensure that those issues are being addressed. So a number of things can be done around the advocacy piece for introducing these systems, which will help you to have end-to-end visibility of vaccine and related vaccine device stocks.
Thanks very much, Karen. As UNICEF and working with other partners, we continue to support LMIS initiatives. There's the Gavi Alliance digitization strategy that's underpinning some of the pieces of that. I know that colleagues are working with a few countries on even piloting, adopting and implementing some GS1 standards. So please reach out, and then we can talk about some of those pieces of work that are ongoing. I think there's a question about logistical challenges. I hope that has been answered now with some of the presentations. In LMICs with huge logistical challenges, what kind of strategies best work for integrated supply chains? Again, when you talk about integrated supply chains, the most important thing is that convening power, bringing people together to be able to first discuss what they hope to achieve. That way, they are very transparent enough to say, your supply chain is working in parallel now, our supply chains are working in parallel. This is what the challenges are in those. And these are the opportunities we have, and being able to bring them together to then decide the way forward. Michelle, do you want to comment?
Yeah, I think it's very context specific as well. And I think it depends on, and I think a very good situational analysis of the country would also help to see where it would be easier to do an integration in a country. So, you know, I mean, I think the planning phase is obviously the easiest. You know, distribution, you get the large efficiency gains there, and probably lower down in the supply chain or at health facility level, it probably makes a lot of sense. But it really does depend on how the programs are designed, how the policies are structured in the country, you know, and various other factors. So that needs, there first needs to be a good understanding of what the current situation is before you can jump into making specific recommendations on what those steps are, and also what do you want to achieve from the certain integration, you know, whether it would be resilience, whether it would be efficiency, whether it would be reaching you know, zero dose communities, you know, so I think that you know, in an exercise like that, you know, those colleagues need to have a look at that and decide on that, on those objectives first. And it's very context specific as well.
Perfect. Thanks, Michelle, for that. Yeah. Very good addition. Nicholas?
Yeah, thank you, Olamide. I would like to take the question that Laura Shimp has put in the questions as well, which is very pertinent, and thank you for pointing that out, Laura Shimp. I will read it out, actually. So, as we have 3 years of infants from 2020 to 2022 birth cohorts, how are integrated supply chains and policies in countries being organized to ensure those older infants vaccinations at any opportunities, not just campaigns, given that those infants are now outside of the current birth cohort? This is, of course, the really important question related to what Shalte asked, because these children need to be caught up or catched up with both their tetanus and diphtheria and pertussis vaccines, but also with measles, because the same children will have missed their measles vaccines as well. And not just once, because we know that in many countries, as many as 20% of the children are continuously missed in this way. So we need to improve the opportunities, to increase the opportunities for children to be caught up. And that can be done by removing any policies or practices that restrict children receiving vaccines based on how old they are, and also remove restrictions on who vaccines can be used for, and how, and also change reporting systems so that it is actually possible to report vaccine doses given to children about 1 year and given to children about 2 years of age. There's also a possibility in many countries to put in place vaccination checkup points somewhere along the way when children grow up, for example, when they start school. And there are many opportunities to have better catch up of children who have missed vaccinations. Over.
Thanks very much, Nicholas. Seeing that we are a minute over, any quick last words, Michelle, Kara? Karan, do you want to go first?
No, thank you so much. And I'd really like to thank all the participants and the wonderful questions that you had. we've been putting in the chat. We know we have not been able to answer a lot of them, but in the subsequent webinars, a number of these would be answered with examples actually of how these things are being done in some of the countries. So I would encourage you to really attend the next two webinars in the series where you would have more practical examples. Today we were just talking about the high-level strategies, but more practical examples and how you implement it would come in the next couple of webinars. So I encourage all of you to join those as well. Once again, thank you for all of you who have joined the webinar today.
Thanks very much, Karan. Michelle?
Yeah, thank you very much for joining. We'll try and answer all your questions as well and share those out as best we can, which particularly those that we have not been able to address in the discussion as well. But also very interesting to hear your insights and experiences as well. So thank you very much for joining, and looking forward to chatting with you again in next week. Have a good afternoon, evening, or morning.
Thanks very much. Alex, anything else? Over to you.
No, thank you. Thank you, Olamide. Thank you, Michelle, Kara, Niklas, and thanks to the interpreters for their work. But this was a great presentation. So we hope to see all participants next week for the second session of this series. I think the title of which is Immunization Supply Chain Interventions, Lessons and Best Practices for Reaching Underserved Zero-Dose Communities. So for me, I think we can close. Olamide, would you like to give a last word?
No, thanks. I think it's been reiterated. I don't have any further on.
Okay, excellent. Thank you very much. So I think we can close this session, and we hope to see you everyone again next week. Have a nice rest of the day. Thank you. Bye-bye, everyone.
Bye, everyone.
Bye.